Good afternoon, everybody. Thank you for joining us today for the Futures Initiative, Revisiting the 10 Essential Public Health Services webinar. My name is Jessica Solomon Fisher. I'm the Chief Innovations Officer with the Public Health National Center for Innovations. I'm joined by my colleagues, Rena Chudgar and Travis Parker-Lee at PHNCI, as well as Katie Sellers with the Beaumont Foundation. I'll note that this webinar is being recorded. We will take questions through the box. You may enter them at any time, and we will answer them at the end of the call. I also just want to note that nothing that we're sharing today is particularly new information. It's all available on our website. However, we've received a number of questions, and so we thought it might be useful to hop on a quick webinar to be responsive to those questions, rather than only pointing people to the web resources, and walk through kind of where we've been and a little bit with regard to where we're going with this initiative. But we're not going to belabor a lot of the background information because that has been presented previously. But again, feel free to type in any questions throughout the webinar. And with that, let me turn it over to Katie Sellers to get us going on the content. Katie.
Great, thank you, Jessica. And thank you all for joining us today. I am really excited that there's been so much interest in this project, and I'm really glad you were all able to make it today. And we're happy to share information about what we're doing and where this is headed, and take your questions. So thanks for making time for this webinar today. Next slide. So just very quickly, our agenda for today is to start with the purpose and an overview of the Futures Initiative, and then we'll give you an update on our progress to date. We'll give you an overview of the vetting process and some of the frequently asked questions that we've been receiving, and then we'll move to the questions and answers section of the webinar. Next slide. So this this project is a partnership of the Beaumont Foundation and the Public Health National Center for Innovations. So for any of you who don't know, the Beaumont Foundation advances policy, builds partnerships, and strengthens public health to create communities where people can achieve their best possible health. And while we're doing that, we really have a particular focus on the public health system, which is why we undertook this project. Next slide. We're really thrilled to be partnering with the Public Health National Center for Innovations on this. As the innovation arm of the Public Health Accreditation Board, they really seemed like the perfect organization to revisit the framework with us with an eye towards the future. Next slide. So as we undertake this work, we really are mindful of the wisdom of the original work to develop the original 10 Essential Services framework, which has really served the field well for over 25 years. And so now we're looking to provide a refreshed framework for public health practice, research, education, funding, and policy. Next slide. So our goals are to bring the 10 essential public health services in line with current and future public health practice to the extent we can anticipate the future by engaging the public health community to assess the current state of use of the framework and updating and refreshing the national framework with the field. And you see a picture of a white paper that was developed before we really started work in earnest on this, where we looked at how the 10 essential services had been used over the last 25 years to make sure that before we go about changing anything, we understood the extent to which they were being used, how they were being used, and what the impact of changing them might be. Next slide, please. So this is just a link to the website where you can stay up to date on all of the latest developments. So the information that we're sharing today can actually be found on the website, but we wanted to make sure that we gave it out in ways that people could consume it at their leisure or in the way that's most convenient for them. And we will continue to be updating the website as new information becomes available in this process. So with that, I'd like to hand it over to my colleague, Rena Chudgar at PHNCI.
Great, thanks, Kate. We wanted to spend a few minutes now talking a little bit about how we got to where we are with the vetting process.
I wanted to start off talking about our task force. Our task force is comprised of a wide array of subject matter experts representing different content and topic areas, established and emerging leaders and practitioners of public health, different public health organizational representatives and types, as well as those task force members who are diverse in a variety of characteristics, really to allow for a broad array of perspectives to be brought to the table to inform this effort. The task force is really instrumental in guiding and really leading this effort to ensure that it really does represent what public health does and what it should be doing. Next slide. The work is guided by these 6 guiding principles, which were developed and agreed upon by the task force, as you see on this slide. As recommendations and decisions are made for revisions to the framework, we continually revisit these principles to ensure that the effort holds true to what we're looking for here. These principles: equity-driven, transparent, inclusive, data-informed, evidence-based, futuristic, and relevant. The task force also intends to honor the 3 core functions of public health as part of this effort, but those are not included specifically in the revisions of the 10 essential public health services here. Next slide. I'm going to talk a little bit now about how and where data were collected and some of the themes that emerged broadly from these data collection efforts. Data were collected from a wide variety of venues from April through November of 2019. We received over 1,300 responses, about 1,350, through 5 town halls, including 3 open webinar town halls, 1 specific to all CDC staff, and 1 in-person town hall at the APHA 2019 meeting. We also had responses through an online questionnaire, through meetings with professional organizations and thought leaders, and other crowdsourcing events. We really attempted to disseminate information and go as broadly as we could for data collection efforts, really, again, to ensure that there was diverse public health perspective inputting into the process. Next slide. Of those respondents, for those that we had organizational affiliations for, there were some data collection venues that we didn't collect that information, but for those that we did have this information for, you'll see the breakdown here on this slide. This is particularly important as we think about the 10 essential public health services really being for all of public health, not just governmental public health alone. As you see here, we had local and state health department responses, nonprofit and community-based organization responses, responses from academia and research, students, federal agencies, and more. We have also recognized that there are gaps in data collection efforts, and we are making a concerted effort to reach out and get input from where those gaps did exist during the vetting process. So again, if you know folks who would be instrumental, especially in some of the areas where you may see we have gaps, please do get the word out and spread information about the vetting. We really are keeping the principle of inclusivity, it's really important to us and really important that this is a field-driven effort to ensure that it accurately represents public health. So please do get the word out and get people to submit their comments. Next slide. For the next slide here, we wanted to provide a couple of snapshots of some of the data themes. So during the data collection efforts, we asked respondents, if it were up to you to dictate the framework for the next 25 years, would you keep the framework but make major revisions, keep the framework but make minor tweaks, keep exactly as is, scrap it and don't create anything new, or scrap it and create a new model? As you see here, we had the majority of folks say that they would keep the framework, but make either minor or major revisions or tweaks to it. We recognize that what some might consider minor and some might consider major might vary slightly, but Again, the point here being the majority said that they would keep the overall framework and revise and update some of the language that's in it. We, again, sticking true to being field informed and field driven, are really following what the data are telling us, and you'll see that in some of the upcoming slides in terms of how they responded to this question. Next slide. We also asked for comments in terms of how folks would recommend changing the framework or what they would recommend adding to it or taking away, if they could provide those comments. So you'll see here high-level themes from responses, again, to this general question about what changes or additions they would recommend to the essential public health services. A note here that this slide only includes the themes that were mentioned in 50 or more comments. So those that have less than 50 responses are not mentioned here. So there may be others that, again, did not rise to the 50 or more level. For kind of calibration purposes, the innovation box that you see on the bottom right had around 51 comments related to it. So then you can get a sense, the size of the box here represents the number of comments. You can get a sense of how many comments were related to some of the other topics. Responses to these were, in many cases, very brief, where someone may have just simply said, add equity or add more on partnerships, but not necessarily elaborated. And in some other cases, we did have respondents submit a bit more detail. So I'm not going to go into the details of what was submitted for each of these topic areas. We are developing a report that will have that level of detail in it and will be available on the website soon. So you can definitely access that information there. But just to mention a couple of these areas, you'll see here that equity was the most common theme that emerged from the comments for what changes folks would like to see. This was related to things like infusing language around power and advantage, infusing language around racism, and the importance of educating staff and others about equity, as well as considering how an equity lens can be used as a lens to which to approach the framework. Collaboration came up, and collaboration was stated as something that's reflected in the framework that exists, but it needs to be considered and infused a little bit more heavily and separated out from community engagement, really thinking about multi-sector and interdisciplinary partnerships. Whereas for community engagement, the themes were really around redistribution of power, engaging those with lived experience in developing solutions, and community mobilization concepts. And last but not least, to cover one more theme, there were some comments around essential service number 7, or the topic around healthcare. There were a variety of comments related to this particular topic here, which the task force discussed in detail. There were some comments that suggested potentially removing this topic completely, whereas others suggested not to remove it, but to clarify what the role of public health is, and also to ensure that mental and behavioral health were reflected accordingly. So that's just a snapshot of a couple of the themes that we saw emerge. Again, we are developing a report that will have more of these details included in that report. Next slide. After these data were analyzed and summarized, our task force convened on January 30th in person to review the data analysis and summary in detail and engage in discussion around areas where conversation was needed and where recommendations would be helpful from the task force. Some of those were around the themes that we just heard, and there were some around other topics as well. The task force then provided their recommendations, which informs what revisions were made to the framework, which we'll get into in just a minute. I do want to note that the task force meeting summary and recommendations are available on the website for you to take a look at as you wish. And with that, I'm going to turn it over to Jessica.
Thank you, Rena. All right, so just as a reminder, and Rena and Katie both mentioned this, that we really are doing this work with the field and taking the guiding principles to heart. So just a reminder that a majority of respondents did suggest either making minor revisions or major revisions to the existing framework. And so the task force had that in mind, along with the data summary and analysis as they were having their discussions and making their recommendations. So it should not be surprising then, based on that, that the proposed 10 Essential Public Health Services framework does look similar to the original, but does have some noteworthy differences. For example, the addition of equity, as Rena just discussed, equity and related concepts were talked about at length, both during the task force discussions and in the comments that we received and feedback from the field. And so it has been embedded in the proposed framework, both in terms of an introductory statement that kind of sets the tone for the framework itself and a definition of equity, as well as in the contents of the services themselves. So it's kind of infused throughout and right at the beginning as a standalone statement. Language throughout the framework has been assessed and considered, updated, and modernized. And I do want to point out that we have been and will continue to work with communications experts. We know that public health folks are, we're not that great at avoiding jargon. And this is a framework that is used both within public health, but also to communicate with policymakers, for students, for the community. And so it really needs to resonate. And so we are being mindful of words. In addition to that, concepts were added that perhaps weren't around 25 years ago, or at least in the same way, like informatics and data use, data sharing, data analytics that has really evolved over the past 25 years and in recent times. An increased emphasis on cross-sector partnerships and on community engagement. That was certainly in the original, but again, things have changed in 25 years, and so there's been more of an emphasis on that and what it means. And as Rena mentioned, the role of public health care and, of public health and healthcare, we intended to clarify as it related to Essential Service 7 and where it was sprinkled throughout other essential services, and that does include behavioral and mental health. I will point out in terms of structure that in the proposed framework, Essential Public Health Service number 10 is new. So it focuses on organizational infrastructure and pulls in kind of the system management elements from the previous version. If you saw in the graphic of the original, those were the words kind of inside the circle. The original Essential Service 10 contents were moved. They were not deleted. It was felt that research needed to be amplified. Those were some of the comments we received. To that end, we did move it and amplify it and combine it with what is now the new Essential Public Health Service number 9. So there are still 10 Essential Public Health Services. A few things were moved around. And the task force also had this discussion about, as it relates to things like workforce or these organizational infrastructure pieces, what is a function or service that is offered to the community, whether from governmental public health departments or non-governmental public health organizations, and really did try to clarify those organizational management related sorts of things and pull out from there what are services and what are functions and ensure that those are in the appropriate places. If we go on to the next slide, this is where we are now. So we took that feedback from the task force. We worked with the communications experts. The task force did have the opportunity to re-review the tweaks and changes that were made after their meeting and have some additional conversation about that. And here we are today on March 5th. So public vetting did open on Monday, March 2nd. It will be open for 30 days. There is an online survey where we encourage you to submit your thoughts on any or all of the essential services, as well as that introductory statement. And we do have a few additional kind of high-level questions, not specific to anyone's service, on which we'd like your feedback. I also want to note that we're in the process of translating both the framework and the survey into Spanish for those who speak Spanish as a first language, and encourage you all to help us spread the word. As Rena said earlier, we really do want to get as much feedback as we can from every kind of facet of the public health community and beyond. We will then engage in data analysis, again, starting kind of April 3rd when that vetting closes, and then develop the revisions to the framework. between April and June. We'll be convening our task force at the end of April, continuing to work with communications experts. And also, I want to touch here on the graphic. So, of course, with the changes to the framework, the graphic will need to change. And we will be working with the communications firm and their designers on what that looks like. Those of you who participate in the vetting survey will have the opportunity to indicate whether you have interest in participating in focus groups to inform what that graphic might look like. We can't promise that everyone will be selected depending on how many people are interested in that, but we wanted to ensure also that we get a good cross-section and different viewpoints on what a revised graphic would look like. So there's that opportunity as well. Excuse me. We are also focusing during the time after the vetting closes on alignment and communications. So we received questions about how does the essential services align with PHAB standards and measures, with the foundational public health services? What will the differences be between the original framework and the new framework? And we'll be putting together a number of alignment documents and tools that you can use to inform your own work or help communicate with others. And then the framework will be launched at PHNCI's second annual Public Health Innovation Summit and Showcase, which is taking place on June 23rd here in Washington, D.C. I do want to note that that summit is a relatively small meeting, so you do have to apply to be invited. We've just extended the application deadline for that, so you can feel free to apply to attend that meeting. Those applications are now due on March 18th. We encourage you to apply. The entire summit and showcase does not focus on the essential services. There's more to the meeting than that, but we wanted to use that as a really nice opportunity to be able to launch this in person. I also want to mention, for those of you unable to attend in person, that portion of the event will be live streamed for free. So you are able to watch from the comfort of your office or your couch as you see fit. And we certainly hope you'll join us either in person or on the web to watch that in real time. And then, of course, we'll be following that up with additional webinars and opportunities to share and promote the framework. So your input really is critical. We feel that it was so tremendously valuable to have over 1,300 respondents during the initial data collection phase, and we hope to meet or exceed that number now, and also to reach the audiences that we were not successful in reaching the first time around. I do want to point out a few things, and it was already stated a couple of times, but that the Essential Public Health Services Framework, both the original from 1994 as well as this proposed revised version, is not about public health departments only. Certainly, public health departments are an integral and key component of the overall public health system, but the framework was intended and continues to be intended to talk about public health practice writ large and is not limited only to governmental public health practice. And I think that's important to keep in mind when you are reviewing this and contributing your comments. It's not just about what health departments do, it's about what the system does. It's also most useful when you suggest concrete ways to address any concerns or questions that you may have, so that we really ensure we're hitting the mark and accurately representing what public health does. I will also note, if you agree with things, please let us know that too. So we want to hear from people who have comments, concerns, suggested revisions, as well as those who say, great job, I like it the way it is. It's really important for us to have all of the feedback from every kind of side of that equation. And finally, that the proposed framework is a standalone document reflecting what public health does and should do in the future. A couple of people have asked whether there's a side-by-side comparison between the original framework and the new version, and the answer to that is no. Obviously, you are welcome to look at the old framework and do a line-by-line comparison if you so choose. But our goal really is to have you look at this standalone document and answer the question, does this reflect what public health does and should do in the future, notwithstanding what the original one said? Things have changed in 25 years, and we want to know, did we get this one right now? So please keep that in mind as well. We do have some FAQs that are posted on our website. Again, those were just developed in the past few days with some questions that came in. We're trying to be very responsive. Another reason to be holding this webinar, especially on such short notice, and as Katie said, we are so grateful for those of you who took the time to join us today and those who will listen to the archive later. And we do have also a few definitions available so that when you're reviewing the document and we use the word equity, you know what we mean by equity. You can click on that kind of draft glossary of terms. There will be more terms that will be defined. Those were just the initial few we thought would be really important to put out right now for vetting. So in conclusion, vetting is open until 11:59 p.m. Eastern on April 2nd. Comments will only be accepted through the survey, not in any other format. We will continue to update the FAQs as new questions come in. And the website really is the best place to stay up to date. All of the information that we've shared today is there. New information will be posted there. Certainly we disseminate it through newsletters, partners, and in other ways. But if you have a question at any time, certainly reach out to us or just go ahead and check that website. And with that, I think we want to turn it over to Q&A. But let's advance to the last slide while these questions are coming in, just so you can really memorize this website for all of your information needs. And I do see a question about Tribal Health Department and that feedback. So we did attempt to reach tribal health departments and organizations during the initial data collection phase, and we're not successful. So we've made a more concerted effort to do that now. We've asked the National Indian Health Board and Seven Directions Public Health Institute to help us disseminate the vetting information and survey. We also do have only one tribal member on our task force, and hope that he can help us reach at least the tribes that he serves in his area. And of course, our distribution list, PHAB distribution list, some of the partner distribution lists do have some tribal entities on there. But I would encourage those of you who have tribal contacts, or those of you who are on the line representing tribes, to please help us spread that word. We absolutely think that their feedback is going to be critical. I would like to remind everyone to please go ahead and type in their questions. I see one more has come in, and I have to admit I'm not entirely sure what the question means. To the person who asked that, maybe we could follow up offline. Since we don't have any audio on the call today, we only have the ability to chat via chat box. But if there are any questions, we do have lots of time. Okay, I see that they're starting to come in, so just give us a moment or two to review and pose these. So one question is, what engagement is there with the federal government? I will say, as you saw on the task force slide, we have several federal agencies represented on the task force, CDC, HHS, SAMHSA, and as liaisons as well as members. We also did hold a town hall specifically for CDC staff, given the immense amount of time and effort and work that they've contributed both during the development of the original framework in 1994 and as it's been used over the past 25 years. The question is there an expectation that the CDC or HHS will accept and own the new framework and shift their funding and programmatic priorities moving forward? Certainly I can't speak to funding and programmatic priorities of the federal government, but I will say we were intentional about including them and having conversations with them along the way, and it is our intention and a guiding principle that the new framework replace the original framework, so that there wouldn't be two versions of the 10 essential public health services. There would be the 10 essential services as they will stand, on June 23rd. I do think it's also important to note, and Rena mentioned this when she was sharing some of the data, that the request from the field was, major and or minor revisions. So if you really do look at the proposed framework, it's not all that different from the old. It really is refreshed. And so I don't know that there would really need to be that much of a shift in federal funding priorities to accommodate this. I don't know, Katie or Rena, if you have anything you'd like to add to answer that question.
No, I don't. I think that addressed it. Thank you.
Okay. Great. So a question came in about what insights have you offered for the sustainability of partnerships, which is critical for their effectiveness. I'll admit that as it relates to the revision process and the framework for the 10 essential services, I'm not entirely sure how that relates to today's call. If anyone else has a thought on that, feel free to chime in.
This is Katie. I've been thinking about this question, and I think it makes a really good point that the sustainability of partnerships is critical. I am not sure that the 10 Essential Services framework does a lot of kind of sharing of best practices or indicating how best to do this or that. It's more what needs to be done rather than how. But if the person asking this question has some thoughts about ways in which the framework could be used to sort of highlight the need for sustainable partnerships more and or offer any nuances that might help the field be better at developing sustainable partnerships, we would very much welcome that feedback through the survey. You know, particularly like language suggestions, little phrases that could be added to the bullets that describe the services or something like that. I think that would be an improvement if that language were offered.
Thank you, Katie. I was missing that was the point, and I think you got it, so that was very helpful. Thank you. We don't have any additional questions coming in, which is certainly fine. We are happy to give everybody time back in their day, but do want to just pause for one additional minute to ensure that everybody has all of the information that they need in order to best respond to the survey and ensure that we've answered all of the questions that we've come here to answer. So we'll give it just one more minute. Okay, it does look like something else might be coming in. Hold on one second. All right, so the first question is, what was most surprising in the feedback that you received? That's a really good question.
This is Katie.
Oh, go ahead.
While you think about what surprised you, Jessica, I would share that the thing that surprised me most was that in conversations I have had with people, I have heard a number of people say, we should get rid of essential service number 7. It shouldn't be there. That's not public health's job. That's healthcare. We should remove that in this modern age. And I would say what surprised me was when we gathered the task force to talk that through, it was extremely clear that they were of the unanimous opinion that you cannot get rid of that service. And it wasn't because they weren't considering it. They considered it very carefully, but they were unanimous in their agreement that that needed to be there. It just needed to be clarified and updated.
Thank you, Katie. I would just note, I guess, and thank you for giving me the time to think about it. I think one thing that came through to me was the extent to which, of course, governmental public health departments are using this, and we knew that both from our work over the years, but also from the environmental scan. But some of the comments that came in were limited to kind of that lens of, a health department does or does not do that. And so it was a little bit of a surprise to me. I think some people have either forgotten or quite honestly never realized that the essential services was actually developed to be broader than governmental public health. So I thought that was a really great that happened during the original data collection phase so that we could spend a little bit more time doing education to ensure that people are contributing their comments now with an understanding that this is about more than just governmental public health, even though we know governmental public health departments are among the largest kind of consumers of the model. Would you be able to repeat the date by which you anticipate having the completed framework available? June 23rd, it will be launched during an in-person Public Health Innovation Summit and Showcase that PHNCI leads, as well as live streamed free of charge for those who do not join us in person.
And there will be further communications after that date to give folks a chance to join additional webinars and other dissemination mechanisms.
A question came in about what was the reason they wanted to keep it, and I think that's related to the healthcare. And again, because this framework is about more than just governmental public health practice, it was thought that healthcare providers, and we do have a definition for what we mean when we talk about healthcare, do provide services that improve population health and are important partners in with governmental public health departments, with social services providers, and there are, in fact, many health departments, as you all know, that offer clinical services, whether as a provider of last resort or to help keep the lights on. And so it was very clear that although there are mixed opinions in the field about whether health departments should offer clinical services, and there's a movement by some to get rid of those and a movement by others to do more of those, that it was important that we clarify but acknowledge the important role that healthcare does play both in population health and in kind of public health writ large. And I would certainly invite Katie or Rena to offer anything additional to that question if you'd like.
I guess I would also offer that there were some specific thoughts about capacity or capabilities that the public health workforce profession has regarding, you know, systems thinking or quality concerns that seemed unique to public health that we didn't want to just kind of let go of and say, oh no, healthcare can be responsible for that. I think that was one of the threads going through there as well.
Great, thank you. There's a question about, is there enough attention to the issues of state-local relationships? There's a real tension on both levels in terms of each level's perspective. I assume this is speaking about the governmental public health system, not the larger public health system. But I would actually pose the question back to the person who answered it. And if you don't think so, please share that feedback with us through the survey and make a recommendation to that end, to how that could be improved. There is a question about, will the essential services address a research and practice gap? There is separation between grassroots organizations and academia, and academics should have more freedom and encouragement to provide tools and technical expertise to nonprofits and community organizations who want to conduct research. I would offer a similar response to you that, you know, please review it, in particular, essential service number 9, and let us know if you think that that gap is addressed, and if not, you know, please do make that recommendation. And the more specific you can be, the more helpful it will be to us as the data is coded, analyzed, and discussed and considered by the task force. There's a question about whether Public Health 3.0 influenced the development of these services, and the answer is yes. The task force discussed it, excuse me, and language from 3.0 was looked at. We were pretty intentional about talking about Public Health 3.0 as a term, because of course that may or may not be used in 2 or 5 or 10 years, but certainly the concepts are important, and really talk about modernizing the public health system, and absolutely we tried to take them into account. Just scrolling through to see additional questions. Let's see. So fast forward 20 to 30 years from now, how would the task force and or you see this framework being used the same and or differently in the future? Katie or Rena, do you want to answer that, or I can certainly chime in? I would say that task force talked about kind of acknowledged through the environmental scan and all of their collective years of practice how the framework has been used to date, and acknowledged that it really should be used however it's most useful. So there are, you know, health departments that use it to structure themselves. There are public health organizations, governmental and non-governmental, who use it as a communications tool. There are governing entities that use it. Of course, it's taught in classes. We heard from people that they use it, you know, with partners, with healthcare partners, for example, to clarify roles. And so I would say that I don't know that we would envision the use of it changing, or that was a goal. I think it's our goal to describe what public health kind of is and does, and hope that we do so in a way that is reflective of current practice and moves us kind of into the future, and that it can be used also as a communications tool for whomever needs it in whatever way.
And I would just add, I think a related question here is the task force has been and will be discussing what does it look like to ensure that this is a framework that is updated regularly enough to appropriately reflect where public health is and where it's going. So whether that's you know, a few years or whether that's 25 years, that's a conversation that's still to be had, but that is one that they're going to be having.
Great point.
And this is Katie. I would just add one thing, which is that I do think there was some focus on the potential use of the framework to advocate for funding. And I believe that that was part of the thinking behind adding essential service number 10 about organizational capabilities. You know, some might say that's something you would take for granted. Of course, an organization or a business needs to be able to run itself effectively. But the idea was that putting it in here might help some advocate for funding, recognizing that a lot of funding comes in a categorical manner and that it can be very hard to support the infrastructure that's needed. So I guess that's just another use of it that I would highlight.
That's great. Thanks, Katie. There's a question around to what extent human and social services organizations and or healthcare organizations were engaged in the development and or will be engaged in vetting. I will say there's a little bit of representation on the task force, but not much. In terms of the development, we really felt that it made sense, given our timeline and for some other reasons, to kind of stay a little bit more narrow to start and then go more broadly. So it was largely kind of more limited to public health in the first place. But during vetting, we have been intentional about reaching some of these other organizations. And I would encourage you to feel free to share it with your partners at the state, local, national, tribal, territorial levels that are in human social services or healthcare agencies. We absolutely want their feedback, and so we expect to see more of that during the vetting. We felt it might be more helpful for them to have something to react to, and so we hope to hear more from them in the next month.
There's a question around using the framework to communicate with those in the public health system. And I would just say, one, as a result of the framework that was developed in 1994, there's been a great deal of work and resources around using the framework as a communication mechanism to talk about what public health does. There's also been associated kind of tools like the National Public Health Performance Standards, et cetera, that go into detail around each of the 10 essential public health services as a way to describe, again, what the local public health system does, that have been used as a mechanism to talk about public health to those who might not consider themselves a part of the public health system, but are. So I think those are great starting points. As we go through the comments that we'll receive through the vetting process and then finalize the framework, we are also, as Jessica mentioned, working with a communications firm to, one, ensure that the framework is kind of speaks to all and as jargon-free as possible, and then two, coming up with associated communications and dissemination materials that can be used in your efforts to promote uptake and use of the revised framework. So those are coming, but I would say if you're looking for materials right now, I think starting with some of the things that already exist might be a good place to start.
Great, thanks. I believe we have gotten through all of the questions. Haven't had any come in just a few minutes here. So it looks like we'll be able to wrap up early. Again, if you have any additional questions, feel free to reach out to us directly. Also, please refer to our website, regularly as we make changes or additional information is available, new resources, we will certainly put it there. And please do complete the survey by April 2nd. We hope to hear from you. And with that, I will let us wrap up a bit early. The archive will be available. You're welcome to share the webinar archive with others, and have a great afternoon, everybody. So thank you so much for joining us, and thanks for your time.
Thank you.